All right, I guess we'll get started and people can just jump in. So welcome to the Health Policy and Management Virtual Open House. I'm Maggie and I'm an Executive Program Coordinator in the department. And I wanted to give just a brief overview of what we're going to do for the next hour or so. The department chair, Dr. Diana, is going to give a department overview, PowerPoint presentation, and then we'll ask the admitted students to give a brief introduction with a few prompts that I'll share during that time, and then a brief faculty introduction, and they can share what research they're interested in, what courses they teach, and their role in the department, and what they like about New Orleans. And then one of the MHA students, Daniel, is going to talk a little bit about his student experience in the department this past year. And then we'll answer some questions. And if any of the admitted students have questions, please put them in the chat box, and then I'll facilitate those questions and direct them to whoever they're intended for at the end. So there's no questions right now. Maybe Dr. Diana can start his PowerPoint presentation, and I will pull up the PowerPoint now.
Hi, everybody. Just say hello while Maggie's pulling up the PowerPoint. Hope everybody's doing well. Okay, I hope everybody can see the presentation now that Maggie has put up. So I'm just going to go through and give you a really brief overview of the department. So we have a number of academic programs and research activities going on in the department. So the things I'll go over with you very briefly here are the Master of Health Administration and our Master of Public Health and Health Policy. We have a certificate in physician leadership, and we also have a Doctor of Philosophy, our PhD degree. So if you can go on to the next slide, Maggie, that would be great. All right, so the MHA program, the program director for this program is Dr. Stranova, who is with us today and will help to answer any questions about that 60 credit hour program. It includes an administrative residency that is an integrated design, which allows students to participate in their practical experiences while they're doing their coursework. We have some joint degrees, both in the law school and the business school as well, if you're interested in that. And we have graduates who end up in a variety of different settings within the healthcare industry, including hospitals and health systems, ambulatory care, long-term care, consulting, and a variety of other settings. So that's our primary health management degree, is the way I would characterize that. The next one is the Master of Public Health in Health Policy. The focus there being health policy, and the program director, Dr. Callison, I think is also on the call with us today, so he'll be able to help answer any questions about that program. It's a 45 credit hour program with a 250 hour field practicum, which is also a practical experience that students get during the course of their degree work. We also have a joint degree here with the law school, and this degree is focused on helping folks who are interested in developing health policy, either at the local, state, or federal level. People who are interested in evaluating health programs and interventions and policies in terms of whether they're meeting their intended goals and so forth, and working around things such as program implementation and development. It's also a really solid degree for folks who are interested in going on to a doctoral program, perhaps a PhD in health services research, or health policy. A really strong quantitative preparation in this degree. Next up, I think, is the Physician Leadership Graduate Certificate. We have collaborated with a local health system and put together a graduate certificate focused on physician leadership. And this complements the work we do both in management and policy leadership development. This program is for physicians who are already not only practicing medicine, but they're working in a variety of management or leadership roles within hospitals and health systems. And this certificate provides credit, 15 credits in areas, as you can see listed here, including things like leadership and innovation, business models, payment systems, communication, accounting, finance, performance improvement, and so forth. So the next one I think is probably the PhD. Is that right? Oh, let's talk about the, actually, let me back up for a minute. The Physician Leadership Certificate is led by Dr. Jean Bate, who I don't think is on the call with us today, but we should be able to help answer any questions you may have about that degree. And then the Health Services, Health Systems Analytic Research Centers, we've sort of jumped to the research side of things. We have a number of research activities within the department. Many of the faculty are active in a variety of different programs. And the Health Systems Analytics Research Center is a collaboration with the local public health institute, LPHI, called the Louisiana, which is the Louisiana Public Health Institute. And Dr. Shi is on the call with us today, who's the director of that center, and many of the projects and activities that folks in the department do are centered in this center. And then the next one is the PhD, our Doctor of Philosophy degree, which is the main research degree in the department. And this degree is 72 credit hours total, although it's not that many. I think it's 32 or so postmasters. I could have that exact number wrong, but I think it's somewhere close to that. Dr. Stecker is the director of that program. I don't believe Dr. Stecker was able to make the call today, but many of the rest of us can answer questions if any of you have questions about this. Again, the focus is on research, development of research skills around health systems and health services research. So it includes, analytical skills, research design, research analysis, and teaching, and prepare students for careers either in academia or in other types of industry settings. All right, next. So welcome. We're delighted to have you all here, and hopefully we can answer any questions that you may have. So Maggie, I'm gonna hand it back over to you.
Thank you.
Sure.
So now we can do some introductions for the participating potential students. I have a few prompts, just if you could state your name, where you're from, what program you're interested in, and then maybe some fun or new activity that you've been doing while you're socially distancing. So I don't have a list of names of participants, and I don't see any new faces. So if anyone wants to start it off, that'd be great. Now I see a list. Anyone?
So my name is Kunal Samir, and I got accepted into the MHA program. I'm currently in my study, locked up, socially distancing. New activities. I've been doing a lot of random workout from home videos. That's been fun and interesting and painful. That's about it for me.
Any volunteers, or I'll go through a list that I'm looking at. About Jennifer. You want to speak?
Hi, I'm Jen. I'm from New York. I live in Washington. I go to GW, study public health there. I'm interested in the MHA program, and I've been picking up arts and crafts projects that I did as a child. So like latch hooking, and like those little craft kits you can buy online to like keep myself busy.
Who else? Raven.
Good afternoon, everyone. I'm Raven. I am a native, a New Orleans native, and I'm interested in the MHA program. During this quarantine, I have also been doing random workout videos, which have also been painful. And I'm just excited to be in this Zoom and learning more about the department.
And Sophia.
Hi, I'm Sophia. I'm a senior at Tulane studying public health, and I'm interested in the MPH and health policy. I guess what I've been doing since we've been social distancing, I've been taking the time to read some more, which has been nice.
Is there anyone else that I missed? If not, then we can go on to faculty introduction. So just if you could say your role in the department, the courses that you teach, your research interests, and something that or your favorite part about New Orleans, food or a festival or whatever you think of. So Emily, do you want to start?
Yeah, sure. Hi, everyone. My name is Emily Harris. I am the Administrative Residency Director for the MHA program. So as Dr. Diana mentioned, the residency portion of the program, I work with students to help choose what's the right fit for them for residency and work closely with students to making sure they get the best experience. And I'm sorry, what other questions were I supposed to ask, Maggie? Sorry, answer rather?
Role, courses, research interests, favorite part about New Orleans.
Okay, so the courses I teach, I am currently teaching foundations of health systems in the undergraduate, but I also teach organizational behavior and health systems concepts at the graduate level. And favorite things about New Orleans, I'm at a loss right now because I feel like I'm stuck inside and I'm not experiencing the things I usually do. I'm really missing Jazz Fest. I'm also, I guess the last major event we had was Mardi Gras, and I think going down this train of thought is just like interacting with locals and just getting, meeting with people and talking with people, which I think is integral to the New Orleans experience. And that is why probably this social isolation is so tough. That's probably my favorite part.
Thanks.
Thank you.
Let's see. Any other volunteers to go next?
I go next, okay, because I already turn on my mic. So can you guys hear me? Okay. Yeah. So my name is Bijan Shi. I'm a professor in the department, and also as Mark has introduced, I'm also direct the Health System Analytic Research Center. And also I'm a vice chair in the department as well. So my main teaching is focused on the PhD courses. I have two courses in most on the cost effectiveness analysis and then modeling. And then also occasionally also teach a policy course on the pharmaceuticals and then health technology. And I also teach a China course, but this year obviously it's not going to happen. So my main research, I know there will have a MPH health policy student and also MHA. We had a very good experience with our math students. Very recently, there's two students took my course in the pharmaceutical policies, and then we complete the class project and then submit those two class report into a peer-reviewed journal and published. So that's kind of something, most of my interaction with the students in the department. So in both MHA students and also MPH students. So in terms of research, the department has a very robust research line now. The biggest one, which most of our faculties in the department are involved, is the Medicaid expansion evaluations from both the access, quality, value, and then the social impact, particularly how it support the employment and financial hardship among those previous uninsured population is a ongoing. And then there's also another project is looking at the opioids and SUD, substance abuse program, which is also part of this Medicaid expansion framework. And then we have a very robust research in the international health, which is very much involved in a research group in the department, and well funded by the Melinda and Bill Gates Foundation. And then they have a footprint in a number of the African countries. Predominantly is in the DRC, the Democratic Republic of Congo. And some of us also has some research in the other countries, in the Caribbean, in the Latin Americans. For me, I have a research in the Argentina, Chile, and then another lines of research we're very good is very much is what we call this kind of called the data-driven research. So as a department, we have a wealth of the data sources available to the students and faculties, including both the Medicaid claims, electronic health records in a local health system, including both the Tulane auctioneer and then some other health systems. That's going to generate a lot of interesting questions. Our students, both the master's and then PhD level students, could be involved in those research. And we're also quite innovative in terms of analytics. So my team and working with some other department faculties, we put together some indicator for the qualities of care in a system, and then how to better identify the good population for particular like a technology or drugs. We also do those kind of research. So we have growing portfolios, and in COVID-19, the department also are working very hard in the research development. So we're expecting that we're looking at some disparities, social determinants of health. And then last but not least is that the dean's Thomas Levist is also part of faculty. So he is obviously a powerhouse in the health equity or health disparity research. And in the long run, we're thinking that there's going to be a large research going growth from that particular research perspective. So I stop here. So feel free to raise questions when we have Q&As.
And your favorite part about New Orleans?
Oh, I'm so sorry. I have so many favorite things, but I think since I have been, when I came to United States, I'm started with Los Angeles, in California, and spent quite a few years in the Midwest, and come here. So I had a little bit of a kind of perspective that New Orleans probably have given me a more sense of community, kind of well-needed the people-to-people relationship. Compared with some other place. So I think that's very part is that you can walk to the grocery store, you can purchase your favorite breads or purchase some your favorite drinks in a very walkable distance in your neighborhood.
Thank you. TJ, you want to go?
Sure. All right. How are you all doing? Kunal, so good to see you again, my friend. Hope you're doing well. I am Dr. TJ Stranova. I am the current MHA program director. I've been on faculty now for about 13 years, also a dual graduate of the School of Public Health, the MHA program. I also did my doctoral work here. The classes that I teach are managerial communications, leadership and professionalism in healthcare, strategic management and healthcare organizations, and I'll be teaching a few sessions of our foundation's course in health policy and management. What else? So I have my favorite parts of New Orleans. I'm going to steal from Professor Harris because I see first of all is all the live music. I should actually be at Jazz Fest right now. I take off pretty much every Jazz Fest day. So after we're done, I'll be listening to it on at least the replays of it on the radio to get myself a little taste of it. And also, of course, Mardi Gras And I'm a little disappointed with Dr. Shi, who rides in one of my Mardi Gras crews with me, that he didn't mention that as one of his favorites. But that's all right, Dr. Shi. I've been a couple Mardi Gras crews and enjoy that, and probably did end up spreading some of the coronavirus as, as we celebrated here. But hopefully by next year, we will have a solution to that, and the music will be back, and the parades will be back, and everybody will be back together again. So, did I miss anything?
No, I don't think so. Thank
All
you.
right.
All right. I'm just going to go down the list then. Does Brigham want to speak?
Sure. Nice to meet you all. Brig Walker, recently joined the department. My background's in molecular biology originally, and a PhD in economics. I focus most of my research now in really two different types of areas. One is, how do providers and patients respond to either new information or new payment systems? So really healthcare reform and different innovative initiatives that a lot of insurers or payers implement to try to drive value and achieve better outcomes for the system overall. The other area is around health disparities and equities generally. So Jana Wisniewski, who's on the faculty here, and I do have a couple projects ongoing that look at access to healthcare services and how it varies by race, ethnicity, gender, and insurance type. And so we hope to have a few papers come out on that this year, as well as some other areas in labor disparities where equal access and the like. So a pretty broad set of interests, but mostly around health access and payment reform. As far as favorite things to do in New Orleans, I'm very much like the city. I grew up in the Pacific Northwest, lived most of my adult life in the Northeast, and my wife is from Atlanta. And so we came down to the South to be back around really kind of her people and the kind of familiar cultural things down here. And I will say, like everyone, we're very much taken by the city. It's a buyer's market for food, for music, and really a lot of fun. We have two daughters, and anytime we take them to a parade somewhere else, they're really disappointed. And I think despite the COVID-19 that's striking everywhere, I think New Orleans is a pretty resilient place, and it'll bounce back in the way that it did with Katrina and other disasters. And so, but still we like to, enjoy the nice weather, enjoy the sunshine, and do the things we can while we're in quarantine. And at present, I focus mostly on research. I've taught classes in economics, but I presently am focusing on research, but happy to discuss any topics of interest that come my way. Nice to meet you all.
Thank you. Jana, do you want to speak?
Sure. Hey, everybody. I'm Jana Wisniewski. I'm a research assistant professor in this department. Majority of what I do is research. So I have an MHA and a PhD from this department, so I have a long history here. I teach Introduction to Health Policy and Management, which is a core course that most students have to take. I also occasionally teach comparative health systems, looking at how the US stacks up to other health systems around the world, both well and poorly, depending on where you look. My research is split domestically and internationally. So on the domestic side, like Briggs said, I'm really interested in health disparities, particularly racial and gender-based disparities in access to healthcare. I'm actually working with Daniel Triggs, who's on this call, looking at racial disparities in the quality of schoolyards among elementary school kids in New Orleans, and finding huge disparities there. So that's on the domestic side. And then on the international side, I work a lot in sub-Saharan Africa, mostly these days in the Democratic Republic of Congo, trying to do research and evaluation there on how we can make the health system work better, be more resilient, and more responsive to the people living in that country. So yeah, it seems sort of all over the place is how weird and quirky it is. You know, you can be driving to the grocery store and be stopped by a parade of wizards sometimes, or a guy walking down the street, you know, pulling a cart, playing music or something like that. Like, you never know what you're going to get, and it's always a fun surprise, even as you try desperately to be productive and go about your daily business. It's easy to get sidetracked into something quirky and fun. So I haven't found that anywhere else, and so I will live here till I die. And that's it for me.
Thank you. And Julie, do you want to speak?
Sure. Let's see if I managed to do that. All right. Hi, everybody. I'm Julie Hernandez. I'm also research assistant professor in the department. I teach the research design class, which is a very much more complicated name. But that's for the doctoral students, which are my favorites to follow and help as they get better and more confident as a researcher. I also teach a I will be teaching as of next fall a GIS class that's going to be a school-wide class if you're interested in that sort of thing. I'm a geographer by training. Originally, my interest was in early warning system for epidemic outbreak and disease surveillance. So I went back to that a little bit in recent weeks for obvious reasons. But right now, most of my work and research is on access to family planning services in the Democratic Republic of Congo. So if you don't see me in my office, I'm usually in Kinshasa. And I work very closely with Jane Bertrand on all of those projects. What else? New Orleans came 15 years ago, 3 months before the storm, immediately fell in love, never left. Things I love about it, the food, obviously. In case you haven't guessed, I'm originally from France, and the most French thing about New Orleans is that at lunch we talk about what we're going to have for dinner, so that's very appealing to me. And then the social scene that everybody has described and the sense of community. Probably what I like the best is what happened last night, where I was walking back from visiting friends who had been laid off, and I was pretty upset about it. And somebody, one of my neighbors 2 blocks down that I had never met in my life, threw me a beer can and a box of Clorox wipes and said, "Hey, honey, hope you feel better soon." That is probably one of the most New Orleans thing ever. And it's kind of, I've seen that city fall on its knees more often than not, and it always picks itself back up. And yeah, so I'm same as Jen, I'm going to stick around, and hopefully you'll like it as much as we do.
Thank you. Kevin?
Sure. Hey guys, my name's Kevin Callison. I'm an assistant professor in the department, and I'm the director of the MPH Health Policy Program. My research, well, it's kind of already been covered, but I do a lot of the work in the Medicaid expansion area. And then I do other research looking at health policy evaluation and impacts of different policies. Specifically, I have a project on paid sick leave that I'm doing a lot of work on now, and looking at impacts of paid sick leave on health outcomes. So I teach in the department. I teach the health policy analysis class. I also do some teaching in the economics department. So I teach a health economics class in the econ department. It's a PhD class, and then a research methods PhD class in the economics department. So my time is split a bit between public health and economics. In terms of what I like about New Orleans, I think, you know, everybody's said that there's this tremendous sense of community here. And I think a really great example of that I'm seeing right now is that I live in the neighborhood where Jazz Fest is held, and we're all really bummed that Jazz Fest is canceled. But, you know, the radio station is playing replays, and if I go outside, all of my neighbors right now are sitting on their porch. They have the radio on, they're playing Jazz Fest and kind of experiencing their own Jazz Fest on their porch. So it's just this really, really tremendous sense of community here that I haven't experienced anywhere else.
Thank you. Dr. Diana?
Okay, my turn again, huh? Can you guys see me? So boy, everybody's pretty much said everything. So my name's Mark Diana. I'm professor and chair of the department. I've been here since just after Katrina, so a couple of folks here have been here a little longer than I have. Also came here and just absolutely fell in love with the city. And for those of you who are here, Raven, I think you said you're a native, so you're here. And Sophia, maybe you're here, maybe you're not, but you've certainly been here this time of year. It's just spectacular right now, and the weather is gorgeous, and it really is sort of inspiring to see people out, as Kevin just described, trying to create and maintain the sense of community that they do. And I just want to echo the resilience that exists here. We will be back. There's no doubt about that in my mind. So let's see, in addition to being chair of the department, I've taught and do teach a variety of things, routinely teach in a doctoral program, a health organization theory course. I've taught for pretty much the entire time I've been here an information systems course on health information systems. That also happens to be my major area of research, primarily looking at health information systems in the hospital setting and how that technology influences hospital performance. I've also done some research on alternative payment and delivery models, things like accountable care organizations. And I'm the PI on the Medicaid project that a number of folks have mentioned that they also work on. Before I talk any more about New Orleans, I just want to mention one thing. You know, every time I do this, we do this at orientation, or we do it for the open houses, and I sit here and listen to the things that all of these great folks are doing on this faculty in this department. It's just so impressive to me. I'm just always astonished by how accomplished and amazing these people are. It's just a real privilege to be associated with all of them. And yeah, so right now, I think the thing about New Orleans I'm feeling like I love the most is not just Jazz Fest, but French Quarter Fest, which many of you may know is one of the largest free music festivals in the world, and always in early April, and the weather's gorgeous. And I'm sad we missed it this year, and absolutely can't wait for it to be back next year. So thanks, guys. It's great to see you all here, and hopefully this is really helpful for you guys as you decide what you want to do going forward.
Thank you. And before we get to Daniel, Victoria, you joined us after the admitted students introduced themselves. So if you just want to say where you're from, what program you're interested in, and a fun or new activity that you've been doing while socially distancing.
Hey guys, so my name is Victoria. I am a pharmacy student at the University of Oklahoma. And I'm finishing up my last rotation, so that's something I've been doing that's been really fun this last month or so. So today I take my last exam and then I'm finally done with the program, so it feels kind of good. But yeah, so I'm interested in the MPH and health policy. I'm interested in healthcare reform, and I like the hybrid program that you guys have down there. I'm also interested, I guess now especially, in the on-campus program. It sounds like you guys have something really cool going on down there. So yeah, that's kind of me.
Great, thanks. And now Daniel is finishing up his first year as an MHA student in our department, and he's going to speak a little bit about his experience here. So.
Hi everyone, as you know, my name is Daniel. I'm from Louisiana, went to LSU, and as Maggie said, this is my first year, MHA student. The department and school is great. It's very manageable, like the schoolwork. You pretty much do your schoolwork and we have fun after on the weekends. It's manageable, and professors really understand, like if you have jobs or if you have a family to take care of, it's all manageable compared to like undergrad, and I guess like pharmacy school is not as hectic and as stressful. And my favorite part about New Orleans will have to be the food. I love po' boys and gumbos and red beans.
Do you want to talk a little bit about the courses that you've been taking?
Okay, so last semester I took Emily's class, Health Systems Policy and Management. the intro to public health, biostats, and forgot the last one. They were all, like I said, were manageable. Probably the toughest one was biostats, but once you like understand it, it's pretty simple. This semester, I've taken like quality management, quantitative decision models, and that was very good on like thinking of processes and doing improvement and process mapping. In quality management, we had a presentation, big project consulting for Tulane Hospital, and just being able to get like that hands-on experience on processes and working with doctors, nurse providers, patients, and being able to actually do a project that we would probably do outside of the classroom. It was very valuable. And all my other classes are pretty much the same of either it's going to be a group project or it's going to be like papers, assignments. And again, like all the professors are great. Either they're like in the school and they're like this just phenomenal person, or they're adjunct and have like firsthand experience to what the career field is like.
Can you talk a little bit about the residency experience as an MHA student?
So right now I haven't started my residency program, but I've had multiple interviews, and just being able to work with Emily and Dr. Stranova, it's pretty much the system is there for you to be able to interview, set up your resume, do LinkedIn network, and being able to get a residency if you plan on doing it in New Orleans or setting up something that is outside of New Orleans, Louisiana. I'm not sure how far y'all understand like the residency and practicum program, but the residency is a little bit more structured compared to like the practicum that the public health students do.
So I graduated in December with my master's in public health, and I did my practicum, which is 200 hours, 250 hours. I did that with the Louisiana Public Health Institute. And that was, I got that practicum through speaking with professors in the department. So I think one of the greatest assets about the Department of Health Policy and Management is that the professors are willing and excited to help you find research or practicum or residency that you're really interested in. If you have a specific topic or interest, they want to work with you and get you placed in some organization or hospital that's really what you're looking for. And another example would be one of my friends is an MHA student. She always knew she wanted to work at a children's hospital, so she pursued the children's hospital here in New Orleans and had a great residency experience there. And yeah, so that's just a little bit of personal anecdote from me. Anything else you want to share, Daniel?
Like I said before, everything is pretty much manageable. I work for the department, and I'm a TA also for Professor Harris, and just being able to manage your time is valuable, and you won't be overwhelmed by the coursework or curriculum.
And I think once you get down to the classes that are really more specific to your program within the department, they're very small, and that's what one of the things I liked about my classes is that maybe the biggest class was 30 people, but then you broke up into groups and you were able to work on, teamwork essentially, because that's a big component of health administration or public health in general. So I liked that it wasn't that big of a class. I think the smallest class I had was maybe 5 people, and that was great too. I really liked that. The general classes like biostatistics or epi, they tend to be larger because you get people coming from different departments. And then also within the Health Policy and Management Department, you have the Masters in Public Health students, the MHA students, and then you also have combined MD, MPH students. So you really get a lot of different perspectives. And that's really interesting too when you're broken up in those groups and you have people from all those different backgrounds collaborating on a project. So I found that very helpful in my learning experience in the department. So yeah, if there are any questions, you can put them in the chat box if you don't want to say it out loud, or if you're comfortable speaking, which, you know, we're an open group here, please feel free to share your thoughts aloud. We can open the floor for questions.
Maggie, can I just add to something you were saying really quickly? I had, so I taught the health policy analysis class this semester, and there were 14 students in the class. And I think it was really great to have a class size like that, because we were able to do things that you wouldn't be able to do in other places with larger class sizes. It didn't quite turn out the way we expected, but we had a trip to DC planned where we were going to Health and Human Services. We were meeting in the House Ways and Means Committee, you know, discussing health policy with people in DC who are part of the process of making federal health policy. We ended up transitioning all of that to Zoom and having the entire experience happen through Zoom, including case competitions that the students presented in front of like the senior health policy advisor to the Obama administration. And so it was just really incredible things I think that we're able to do, given what Maggie was talking about in terms of like you know, these manageable class sizes where you get a lot of interaction with the faculty. So.
And that just made me think of also a great component of the department is our lunch and learns or guest speakers that we have. We have several throughout the semester, and I've found those to be very informative. And yeah, so it ranges from people within hospital systems or geared more towards health policy. So that's another great aspect.
I just want to build off the same with the small class sizes. The cohorts are pretty close. I think the student, the body within the department, we have a really good culture there. But ultimately, you want to graduate from the program, and once you graduate, you all become alumni. And the nice thing about the small class sizes and this closeness with the cohort is we have an amazing alumni network. I've really never had an alumni tell me no for anything that I've asked, whether it be like, you know, Maggie talked about the lunch and learn, like coming to speak to classes, participating in our accumulating events. And for, you know, with my role as residency director, I get leads on new opportunities all the time because of our alumni network. So I think that, you know, it's really kind of important to understand that the culture that we're talking about within the department extends long after your time at Tulane.
Then can I say something else? To piggyback on what everyone else is saying, you know, we presented our research projects and those sorts of things. And I know that a lot of you might not be interested in getting a PhD and being a researcher for your job, but it can be really valuable to get a little bit of research experience while you're in school. Learn how, you know, data is collected and how you analyze it and how you make a pitch to a policymaker. And I think everyone in the department who does research is really open to working with students, having you come alongside of us and learn in those projects, or mentoring a project that you might pitch to us that you would want to do. So I've worked with students to, you know, send them out to do surveys around New Orleans, or have them analyzing or performing or analyzing interview data. You know, there's lots of ways that students can be involved. And so just to let you know that that's an option. And if you're interested in anything any of us are doing, reach out, and if we can, we'll get you plugged into that.
Does anyone have any questions? All right, well, that was all that's on my agenda. If anyone wants to share, any faculty wants to share anything else, please feel free.
Well, I want to
here's
say
a
one
question.
thing go ahead.
No, you go.
Well, I want to share one thing with Daniel. I haven't had him in class yet, but now I know not to go easy on him.
Is there any deadline for class registration? I
Answer
don't
that
know the
question.
answer. I think within like a few weeks after starting the class. I'm not 100% sure.
So the add drop period typically ends 2 weeks after the start of classes. And so if you haven't registered or you need to make changes to your schedule, you'd have to do it within those 2 weeks. Typically, at this, at the graduate level, it's not, except for some of the more general classes, it's not a major challenge getting into classes, but it's still best to try to get registered as quick as you can or as early as you can and make sure you get in there. But if you have trouble getting into a class because it's full or there's some kind of restriction on it, if you let us know, we can oftentimes work that out for you. I see Dr. Stranova shaking his head. He's had a lot more experience about this than I have. So anything you want to add to that?
No, you're right. You're right on the point there, Mark. But yeah, our classes are small enough, that if you're an MHA student or an MPH student and you need a class, you're going to get into it. So we do want you to register as quickly as possible, so we have a general idea of who's coming in, so we can prepare. But if you're sweating it out, say, "Oh my goodness, I've got to, I've got to get it in today because I'm going to be, close out of these classes," we'll work with you and we do that. But please don't wait till the last minute. If you have the opportunity to register, please do.
The next question, if I follow the example class schedule on the MHA website, is that satisfactory? Will that work?
I'll answer that one, yes and no. So that is a model course schedule that you see. So there are, that's a starting point. So what we recommend that you do is that you before you finalize your schedule, especially if you are thinking about taking electives, that you meet with your academic advisor. There's also some, it's also particularly important for this semester. We don't know what is necessarily going to be going on if we have to move some classes around a little bit. We're moving forward at, anticipating that we will have everybody here and being taught in class in the fall. But please do double check with your academic advisor before you are all set with your classes.
Can I just say the same thing goes for the MPH classes too? There's a mock schedule online, but I think it's helpful to talk through those classes before you sign up for those. So if you are a prospective MPH student and you're thinking about signing up for classes, please reach out to me and we'll set up a time to talk.
I have a question. For the on-campus program, where do most students live, or is that just kind of up to their preference?
So I can, Daniel, you want to go first or me?
You can go.
Okay. So I'm not sure how familiar you are with New Orleans, Victoria, but New Orleans is really a city of neighborhoods. And every neighborhood's kind of different, so it's really up to you, your preference. So many of our students, I'm not sure if you are familiar, we have a split campus. So we have an uptown campus where our undergrads, our business school, our law school, and other schools are there. Then we have the downtown campus where the School of Public Health resides, kind of close to the French Quarter, along with the med school, school of social work, health science center. So we have some students that live downtown. I live downtown. I love it because they can walk to classes, access the CBD, the Bywater, of course, French Quarter, et cetera, et cetera. We also have a lot of students who live near the uptown campus because there is a very robust shuttle service. So students will live near the uptown campus and then walk to the shuttle, and the shuttle will take them down to our campus. Also, we have students who live in mid-city, take the streetcar down. We have some people who commute in from a little further out, but kind of spread out. Also, if you are new to New Orleans and you're just a little overwhelmed of what neighborhoods to live in, we do have a graduate housing on the downtown campus called the Riley Pavilion. So some students live there for a semester, maybe. Sometimes they stay there because they like the community there, but they get used to their surroundings in New Orleans, and then meet hospital. Also, we have a very good Facebook page for incoming students, and so individuals meet students through there. They they give tips about where to live, what may be coming available. Also, our HPM students are very good at helping and reaching out and giving advice as well. As I'm sure Daniel will jump in and do right now. So Daniel.
So like Dr. Shanova said, most students, they live like uptown if they want to catch the shuttle, if they don't really have a car. Uh, some people do live in like mid city in like this area called Bayou St. John, and they like bike to class. And others, they'll live like here and there throughout New Orleans. I personally live in a area outside of New Orleans called Metairie, and that is like a 20-minute drive depending on traffic, and it's pretty easy. The city is pretty easy to get to. For the downtown area, there's a few parking spots, or if you're lucky, you get to find like the free parallel parking. You just have to watch it. And if you bike, there's bike racks at the school, and the shuttle is very reliable.
Yeah, I take the shuttle. I live uptown, and I take the shuttle downtown, and it's over the years I've been here a while. It has gotten a lot more consistent. So, which is surprising for New Orleans because if you're on time, that's weird. But for the most part, it's very reliable. And I like uptown because it feels it's just a really nice neighborhood. I like it.
Thank you, guys. I guess just one other question from me then before I go here. In terms of the culture on campus at Tulane, I know that on the website it seems like you guys focus a lot on health disparities and trying to advocate for reform in a way that'll benefit communities. But what would y'all say the Tulane culture feels like to you? However.
I'll take the first swing at this one. I spent some time in student affairs. So I think that the students that we tend to attract have what I consider a mission mentality. So there are people who come here to make a difference. And as our dean will say, if you ever meet him, he says you can find just about every single public health problem right outside our doors here at Tulane, whether it's access to to health services, whether it's it's environmental health issues, whether it's tropical medicine. So we have all of these these issues that are right outside of our doors, and fortunately we have the students who are interested in tackling them, and they do that in many ways. So they do that through their practicums or their experiential learning. We also have a very robust student government association, student organization. So we have an SGA, but under them there are 8 different student organizations, each their own particular focus on public health issues. So many of our students join what's called HIMSLA, which is the Health Management Leadership Student Association. I think I may have that right. And they tend to focus in on issues of health access, health, making systems better. But we have other organizations that are out there. So we do have a culture and an expectation for students not to just come in, go to class, go home, study, come back. We expect, we have an expectation, especially in our department, that students, come in, become involved in what we're doing in the department, what we're doing at the school level, what we're doing at the university level, and what we're doing at the community level.
Yeah, so let me just add to that. Yeah, I think TJ said exactly right, that the students here are mission driven. I said this about being inspired by my fellow faculty here, but when I teach, this semester, for example, I was teaching the intro course to the School of Public Health students. It's the course that covers, health policy and management. For everybody, it's sort of the intro, and so there's students from every department in there. And I've been in healthcare and public health for decades. I won't say how many decades, a long time. And these kids inspire me every time I get in front of them. But they're really inspiring because they want to go out there and make a difference. They want to change the world, and they want to do it right now. And it's, as TJ said, there are lots of different ways they try to do that, and there are lots of different interests that they have, but they're just all incredibly inspiring. So I don't know if that's really what you mean by culture, but I think you'll find it a really sort of invigorating and inspiring kind of culture.
I just saw Charles is on. Do you want to speak about your courses and your role in the department?
Sure, yeah. So I'm a health economist, and so I'm going to teach health economics, which is required for the MPH and MH programs. And in class, that looks like some case-oriented learning, where we talk about from the MH side, it's this movement to more away from the fee-for-service reimbursement model to something that more values efficiency. And then from the policy side, we talk a lot about health insurance. So I've previously had some experience, actually Bernie Sanders and Barack Obama and Mitt Romney, and on various plans. And the course kind of takes those cases and then fills in some details with theories that underpin how we think about pain and how people value their health and their access to care. And we also incorporate some behavioral economics stuff, which is pretty cool, about these nudges. I don't know if you're familiar with the small, subtle signals that we can change, and how we can kind of shape policy, necessarily spending a whole lot of extra money for that. And then on the PhD side, I teach econometrics, which is the math that separates correlation from causation. So that's me.
And what's your favorite part about New Orleans?
Without hesitation, it's the food. I measure my disposable income in units of restaurants. So what it takes to pay the babysitter and go out.
Thanks. All right. Any other questions or comments? If you don't have any questions that you can think of now, I can put my email in the group chat, and if you think of anything, feel free to email me and I can send it out to whoever can best answer the question. If you don't know or don't remember the faculty member's name, I'm happy to do that. So I'm going to put that in now.
You could also, find our contact information on the website. If you have, interest and you want to talk with any of us individually, just reach out. I'm sure all of us would be happy to talk with you, answer any questions we can.
Yeah, I was about to say the same thing. If you want to reach out to me, I'm happy to Zoom. I love talking to people, so it energizes me. So if you have any more questions about the MHA program or the department in general, the school in general, New Orleans, just shoot me a quick email and I'll shoot you back a Zoom link.
Oh, here's a question. Sorry. In regards to the MHA program, are there opportunities to obtain certifications such as Lean Six Sigma through classes?
Right now, I'm in a class, two classes where the adjunct professors are both black belt certified in Lean Six Sigma, and they go over like all the information, but we do not get a certificate. But what they went over is very insightful of like the process to actually obtain it and the amount of hours that's needed and the actual material that's like in the exam, I guess.
Yeah, actually, we've looked into this a number of times in the past, and I don't know, Dr. Nova, if you want to add to this or not, but it turns out to be more complicated than you would think to incorporate certification for things like Lean Six Sigma or other quality certifications in the context of a class, which is unfortunate because it would be awesome if we could do that. But as Daniel says, we obviously and clearly get into the content and the and the knowledge that's required there. But the certification generally has to be pursued individually by the student.
Yeah, we've had students who have gone on to obtain the certification. So whether it's directly after they take the class and become very familiar with the with the material, or we have had also students, depending on where they end up for their administrative residencies or even practicums, where they may be working in an organization or on a project with some individuals that want to sponsor them. And they have received their their black belts through their administrative residency organization. So that has happened in the past too.
Any other questions or comments? All right, well, that's all I have on my agenda.
Thank you all.
So.
Yeah, thanks everybody for attending. You guys are going to get a follow-up email from admissions. I'm going to send your contact info to Maggie so she can keep up with you guys, and she'll have that as well too. But you can always reach out to anyone who's been in the session today or to the admissions email address if you don't know who to ask, and we'll get you the correct person to answer any of your questions. I see TJ just put his email address there too. But our website is really helpful. I think someone said that earlier, and you'll be hearing from us. So thanks for attending today.
Yes, thank you all so much.
Have a good one.
See you later.
Thanks.
Bye-bye.
Bye.